Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us. In this segment, we're going to have a conversation with Dr. Thomas Marcotte. He's joining us here as Professor of Psychiatry and co-director, Center for Medicinal Cannabis Research at the University of California, San Diego. He's joining us to talk about a study that was recently published in JAMA concerning the effects of cannabis use with driving. Welcome to Health Professional Radio, Dr. Thomas Marcotte. Thank you for joining us.
Happy to be here. Thank you.
I did, of course, mention your position and your role at the University of California, San Diego. Give us a brief look into your professional background, and then let's talk about cannabis research.
Sure. So I'm a neuropsychologist here at UC San Diego and have a longstanding interest in the effect of drugs as well as everyday functioning, such as driving performance. At our research center, the Center for Medicinal Cannabis Research, we've been doing clinical research looking at both benefits and possible negative outcomes relating to cannabis for over 20 years. One of the key areas of interest of mine, again, is on driving performance. And so in this recent study, it's one of the largest ever done. We looked at 191 cannabis users and had them come in, smoke either a cannabis cigarette with 5.9 or 13.4% THC or placebo, and then follow them through the course of the day using driving simulations.
And were these candidates, were they of differing age groups, different male and female, things of that nature? Was it just a cross-section of normal, everyday America?
It was generally healthy adults. Our recruitment criteria were between age of 21 and 55. We ended up with about 40% female, fairly good representation between ethnic minorities and racial groups. And it was a fairly broad spectrum of people who are current cannabis users.
Okay. And all of them were current cannabis users, correct?
Correct. The people in our study used a range. Some used once a week. You had to use at least 4 times a month. Some people were daily users who used a joint perhaps more than once a day.
Mm-hmm. How were the results tallied?
So for the study, we used a driving simulator. This was a sort of widescreen 3-monitor simulation console system where you sit in a seat, similar to an automobile. It's completely interactive. And we had participants go through a number of different challenges during the course of a 25-minute drive. These included crossing over, making a left-hand turn against traffic, going through yellow lights, crash avoidance situations, and also situations where they had to divide their attention and take their eyes off the road to respond to stimuli on an iPad. They came in and they did a driving simulation that they were trained on days before, so it felt very natural to them. They do the simulation, they'd be randomized to get either placebo or THC, and then we do 4 additional 25-minute simulations throughout the course of the day.
So what were some of the significant findings, and was there anything that you discovered that surprised you?
There were a number of very interesting findings. So again, these were 191 individuals, 128 received active THC, and a couple of things have emerged from this study. One is that we gave people either a 5.9% or 13.4% THC cigarette and told them to smoke as they do at home to get high, so they could choose how much they inhaled. And they ended up achieving the same level of highness, the same level of driving performance, and very similar levels of blood THC concentrations. So they self-titrated. The amount of THC in the joint really did not matter. They smoked in such a way to end up at the same level when using. So when we have concerns about increasing THC content in dispensaries, clearly there's worry about things such as dabbing, but at least with plant material at these levels, it looks like higher levels don't necessarily mean that a person gets higher. They smoke it in such a way to end up kind of at the same point of impairment. We also found that people who would smoke, about half of them felt too impaired to drive after 30 minutes. They said, I'm too high, I would not go on the road. And then by 90 minutes, they felt it wearing off. They thought they were doing better and they were more likely to hit the road. In reality, when you look at their driving performance, the simulation levels did not change. They were performing about the same, but we see this disconnect at about an hour and a half where they're feeling it's wearing off, but actually it is not. When we got out to 3.5 hours, it actually was starting to wear off. And by 4.5 hours, they were right back to baseline and doing the same as placebo. But very concerning is sort of this 2-hour time point where people feel better, but in fact, their performance is unchanged. from earlier.
Were the results similar to behaviors of people in dealing with alcohol, in that you said this, there were some who said, hey, I'm too high, I wouldn't get behind the wheel. I often don't hear of people drinking alcohol saying, I'm too high, I'm not going to get behind the wheel. Was there a difference in smokers as opposed to drinkers, or was it even looked at?
Well, in general, we did not do a head-to-head comparison. We did not have alcohol as part of the study. We actually do have that as part of our next study. But in general, most studies, including ours, find that people who smoke cannabis tend to be more cautious. They tend to be more inclined to consider themselves impaired and to drive more slowly than under the influence of alcohol. Now, clearly, that's, at the group level, there's always individuals who drive very dangerously under the influence of cannabis. But in general, people are more likely to be aware of impairment. But as our study found, that doesn't necessarily mean it's always accurate, especially a little time out after smoking.
You mentioned that the amount of THC really didn't matter. The higher level didn't matter, so that worrying about higher levels of THC in dispensaries shouldn't really be that much of an issue based on your study. But do you think that these results could ultimately affect legislation when it comes to cannabis use and driving or testing drivers for cannabis use?
That is hard to say. I will say there were a couple other important findings that, that we felt are important, at least for policymakers to consider as they, look to really deal with a very complex situation. One is that in a very large sample here, we reinforced some other findings that people have reported that, for example, the THC concentration in blood really has very little relationship to whether a person's impaired. So when we look at blood THC concentration collected right after they smoke and then driving performance about 20 minutes later, the correlation was in essence zero. It just does not relate. What happens with THC is when you at least inhale it, it very quickly disperses. So levels go very high quickly, but then it disperses to fatty areas and to the brain, and it's out of the blood in about an hour. About 90% of it is no longer in blood. Whereas with alcohol, it's more of a linear effect where you see blood alcohol levels go up, people become more impaired, they start going down, people become less impaired. In the case of cannabis, you cannot make those kinds of assumptions. So there are a number of states and other entities that pass per se laws saying if a person has THC of a certain level in their blood, they're sort of considered impaired at that point. Our study shows there are flaws in that, and there are other studies showing that people can have very low levels and still be impaired, which would be consistent with our study, but also have very low levels and not be impaired. So you really cannot turn to biological matrices right now to determine whether or not a person's under the influence.
What is it that you'd like, anything else that you'd like our listeners to know about your study and why it's important?
Well, I'll say one other, I think, very interesting finding from our study was we looked at the issue of tolerance, where people believe I'm a heavy user, I can handle more THC and do just fine. And in fact, we found that the people who were more regular users had higher blood THC concentrations than those who were less frequent users, and they performed just as well as people who had lower THC concentrations. On the other hand, they also ingested more. So they ended up at the same level of impairment, the same level of poor driving by adapting to that tolerance, by getting more into their system. So even though you're an experienced user and you're accurate that, yes, you can handle your THC better, when people seek out a certain level of highness, you still may be a risk on the road.
Give us a website where we can learn more.
So our center is located at www.cmcr.ucsd.edu. And that covers both this study as well as a number of our medicinal cannabis studies looking at relief of pain using cannabis. The other website I could refer people to is JAMA Psychiatry. If you look up my last name, we actually did an author podcast through JAMA Psychiatry, and the article is free access. We've made sure it's available to the public.
It's been a pleasure speaking with you. Lots of great information. Hopefully you'll come back and talk with us again in the future.
Thank you. I appreciate joining you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Thomas Marcotte. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.